So I know it's the beginning of 2022, but this is important for you folks that are in the Medicare Advantage open enrollment period, January 1st to March 31st. And this is from Q1Medicare.com, their news articles. So top 10 ways your current 2021 Medicare plan, also known as a Medicare Advantage plan, can change in 2022. So many people are reluctant to change their Part D or Medicare Advantage plan coverage year to year, and I've been saying that because of duration coverage. However, millions of beneficiaries will see significant changes in their 2022 Medicare cost and coverage. And so if you stay with your current 2021 Medicare plan into next year, please be sure to review your plan annual notice of change, also known as ANOC letter, and use the list below to help you look for important changes that might impact you in 2022 coverage. And so it's important during this time period that you know the top 10 ways your Medicare plan may be changing. Here's number one. 2021 plan may no longer be offered in 2022. This is happening to a bunch of plans in Pennsylvania. Over 190,000 people are currently enrolled in a 2021 Medicare Advantage plan, MA or MAPD, or Medicare drug plan that will no longer be available in 2022. The 120,000 people will lose their 2021 Medicare coverage, also known as Medicare Advantage plan coverage, unless they enroll into another Medicare Advantage. And it says Medicare plan, but it means Medicare Advantage. As example, these counties are seeing the largest number of terminated 2022 Medicare Advantage plans. Monroe County in Pennsylvania is losing 11 plans. Lackawanna County, Luzerne County, both in PA, losing 10 health plans. So that's, if you're in those service areas, that's when you need to tell somebody in those areas in PA that they need to quickly look into other coverage, and they'll be getting a letter as well. But a lot of folks don't look into those things until last minute. So you can click to read more about the article. So that are being discontinued in 2022. All right, number two, you may be automatically reassigned to a different 2022 Medicare plan. And so in my opinion, that is that's almost criminal, because look at how many people are being reassigned. So the insurance companies can keep the payments going per enrollee from the federal government, from CMS, from Medicare. 4.4 million people, 1.2 million enrolled in 21 Medicare Advantage plans, and an additional 3.2 million enrolled in 2021 standalone Part D drug plans. 4.4 million, that's a lot, will be automatically crosswalked and merged into different 2022 Medicare plans with changes to their plan cost and coverage. That means you didn't get a choice. That means they literally took that book of business, 4.4 million, whichever insurance company it is, and continued that payment from the government to the actual insurance companies, even though you had no say into it, and they crosswalked you over. So for example, the members of the 2021 Florida WellCare RX will be automatically reassigned to the WellCare value script. And so that's a different formulary, and if some of your drugs aren't on that formulary and you didn't shop it, guess what? They automatically reassigned you, even if your old plan had your prescriptions on their formulary and it had coverage on it. So be sure to be aware of that if you're part of those folks that are been crosswalked or reassigned automatically. Number three, your monthly 2022 Medicare Part D premium may be increasing. So about 4.4 million Medicare beneficiaries will see their monthly 2022 Part D premium increase 20% or more. Over 150,000 people currently enrolled in 2021 in Part D. Let me make this a little bit bigger so y'all can see. We'll see their plan premium double in 2022. Again, this is means that you're not saving. That means you're paying more. Good news is that 2.5 million people will see 2022 premiums decrease by 1 to 66%. You can click here to see examples of 2021 Medicare Part D drug plans that are increasing in 2022. So I'll leave this link so that way you guys can click on this. Please keep in mind that in additional 20 lower premium Part D drug plans, there may be a low or zero premium Medicare Advantage plan in your area. They're always selling Medicare Advantage. They're always going to try to get you off the Part D and onto a Medicare Advantage because the insurance companies get paid per enrollee on average $1,000 or $1,200 per enrollee per month, whether you're sick or healthy. Number 4, your plan's initial deductible may increase. 2022 drug plan deductible will increase up to $480, up from the standard deductible $445, affecting 9.8 million people. 3.4 million Medicare beneficiaries enrolled in Part D drug plan, having even larger initial deductible of $70 or more. And so this might look scary to you because if you have a paying for a Part D drug plan and your cost sharing is going up, it may entice you to jump ship to a Medicare Advantage, and that's where they have max out of pockets. That's where they don't have they might have some drug coverage in the formulary, but literally the insurance companies and lobbyists are literally trying to make it to where the privatization of Medicare is happening more and more, and that is a true testament since Medicare Advantage is 42% of all Medicare beneficiaries that are on Medicare. Okay, of the 62 or 63 million folks that are on Medicare. All right, number 5, your 2022 Medicare plan's initial coverage limit may change. So standalone Part D drug plan uses the initial coverage limit, so it change of $4,430. However, in 2022, Medicare Advantage plans offer that ICL other than the standard ranging. So the initial coverage limit can range from $4,150 to $10,000. So the higher the coverage limit, the better. I'm not seeing those on individual plans. Maybe that might be on egg whips or group Medicare Advantage plans, but your drug plan ICL sets the boundaries between your Medicare Part D initial coverage phase and the donut hole or coverage gap. So we're still talking about the donut hole, still talking about the coverage gap, because a lot of people don't want to be in that and have a higher cost sharing percentage. The ICL is measured by the total retail value of the prescription drug purchase. You can click to read more about the 2022 Medicare Advantage plans that have increased and detailed initial coverage limit. Again, I'll have the link below. Number 6, your 2022 drug plans formulary and drug list may cover fewer medications, as we all know. Although 2022 Medicare prescription drug plans will be adding more medications based on our analysis. Over 1.1 million Medicare beneficiaries enrolled in standalone Part D drug plan will see at least 100 fewer medications on their formulary. So it's like an average medication list was anywhere between 4,000 to 5,000 to 6,000 on the formulary list of different type of prescribed medications. In addition to some of the low-cost generic medications, particularly Tier 1, Tier 2 generics, may have been moved to a higher drug tier. That's good to know, because you want to know what they categorize and what tier they put those medications at. So if that's a game that they're playing to where they're putting it higher and higher, you might want to call your drug plan to see what is the and speak with your doctor as well. Have the formulary list in front of your doctor to see if there's a good alternative for you that you and your healthcare provider can agree upon. And that will save you money. Okay, important. Remember that the larger formulary does not necessarily mean the Medicare drug plan will cover all the medications. So please check that and make sure that medications are affordably covered by the chosen 2022 Part D drug plan, of course. Number 7, getting to the end here. Your 2022 Medicare prescription drug cost sharing may change. Of course. Okay, Medicare plans change from their fixed copays from year to year, such as Tier 1 drugs as $5 copays, or plans that may increase the coinsurance percentage. For example, a fixed 25% coinsurance will pay 45% of the Tier 4 drug medications 2022. Some Medicare plans may change between coinsurance percentage of retail costs to copayment as sharing as a cost sharing model. Okay. You can click here to see examples of Silver Script Choice will change from $35 copay to 70% copay for Tier 3 preferred brands, meaning that you will save money in 2022 if your Tier 3 drug have retail costs under $206. Meaning retail costs under this change will affect almost 3.4 million current plan members. Oh man, I hope you guys rewatch this again or read this for yourself. So basically, it's giving you the insight on making sure you don't hit the threshold for the Tier 3 preferred brands. And obviously, we know if it's a preferred brand or a Tier 3, it's going to be a high costing medication. So just be aware that higher the tier, the more likelihood you're going to have to pay more out of pocket, whether it's in cost sharing. Okay, so at number 8, your Medicare plan cost sharing can vary significantly between preferred and standard network pharmacies. Yes, just like when you have doctors networks or hospital networks that you're allowed to go to in your Medicare Advantage network-based plan, you have pharmacy networks, and I've also mentioned this in the past as well. So 97% of all 2022 standalone Medicare prescription drug plan PDPs will use different cost sharings for preferred and standard network pharmacies. So you want to know if it's preferred, it's going to be lower cost to you per drug per medication that you have. So for example, California Silver Script Choice PDP will have a copayment of $0 for Tier 1 medications at preferred network pharmacies, and for the same Tier 1 drug medication, $5 copay when purchased at a standard network policy. So these are all pre-negotiated deals with the pharmacy benefit managers, the PBM, I always get it confused, PBM, and you can click here to see more examples of standard or preferred pharmacy cost sharing. And you can connect to your plan member service department to find preferred pharmacies in your area using the toll-free number found on your member ID card. So always do that as well when you're speaking to the plan customer service. If you're trying to lower down, like say, the cost of a medication, to see what is an alternative medication that your doctor could prescribe that could be on the formulary that's similar to what you're using to be able to for the doctor to know, for the doctor that knows your medical situation and your medical needs. Okay, number 10, almost done here. Your 2022 Medicare Advantage plan maximum out-of-pocket, also known as MOOP, spending limit may change. So Medicare Advantage MOOP threshold limits how much you will spend on co-payments, co-insurance, and network. Remember, look, network. Eligible Medicare Part A and Part B coverages. The Medicare Advantage plan MOOPs limit can change year to year. Hear that? Year to year. That doesn't happen on traditional Medicare in such a big fashion. It does change, but not like this. And ranges from $3,400 to $7,550, and really depends on the Medicare Advantage plan, your service area, and whether you are, in network. This is in network. So for 2022 Medicare Advantage plans having MOOP over $3,450, a lot of them, in addition, have gone up 40%. In 2022, Medicare Advantage plans have a MOOP of either $6,700 or $7,550. So that means if you were crosswalked, remember, if you were crosswalked at number, let's see here, reassigned at number 2, if you were reassigned on a Medicare Advantage plan, the 4.4 million people, right, and 1.2 million enrolled in Medicare Advantage 2021. If you're part of the 1.2 million people enrolled in a Medicare Advantage plan and you were crosswalked to a 2022 Medicare Advantage plan, look at your MOOP. Your MOOP is now going to go up, whether it used to be $3,400 to $7,500 to exactly. if it was lower, 3,400, and now it may be higher, 6,700 or 7,550, and that is in network. If you look at it, some of the out of network, if it's a regional PPO, it's $11,000 or $10,000. And I don't know about you, but insurance is supposed to be there, especially your Medicare insurance plan, especially when something catastrophic has happened, like you're about to go into the hospital or the ICU or just some urgent care, and you need their medical attention, and you're in a state where you're not able to get the coverage or know if the hospital or provider is in network. And this happens all the time. Look in the news. All right, last thing here, your 2022 Medicare plan may have added new features and coverage. So now insulin used to be $1,200, $1,200, $1,500. Insulin, like low-cost insulin from Canada used to be very low cost, like maybe with the units that the people were getting from the U.S. to United States. There's a PBS news story about mothers and parents getting on a bus together, renting the bus, and going over the border to get insulin for as low cost, like $300 to $500, where in the U.S. it used to be literally over $1,000 for a vial or for insulin for type 1 diabetics. So now that there's low cost insulin, thank goodness, coverage now for 2022, Medicare Part D and Medicare Advantage plans now participate in senior savings model. And so that's a good model, offering various types of insulin for $35 or less copays. Literally, it's gone down. I don't know what the percentage, that's got to be over 600%. Like literally, it used to be $1,000, and you couldn't get affordable insulin for type 1 diabetics that really, really need it. And that's a lifesaver for sure. So we show the text such as select insulin copay or select insulin pay $35 copay in our Medicare Part D plan finder, pdpfinder.com. Oh, that's kind of a cool site. I'm going to check that out. And then our Medicare Advantage plan finder that has it right here. And you can do this on Medicare.gov as well, but you just have to look at the details or have an independent brokerage and done-for-you service like Medicare Savings. You can go to medicaresavings.us. All right, shameless plug. All right, you can then click on the browser formulary, click to check the plans formulary for the types of insulin covered. All right, that's good news right there. At least it ended on some good feature and coverage for the Medicare beneficiaries needing insulin. Okay, so Medicare Part B premium give back. So I've done a video on this as well. Remember, premium give back is not a Medicare program. It is a Medicare Advantage enticement or inducement for the folks that are on traditional Medicare to give up their original Medicare rights and go literally with the optional alternative known as Medicare Advantage. And I make my point right here. It says, look, more 2022 Medicare Advantage plans are now offering Medicare Part B give back feature where you will receive a partial or full refund of your Medicare Part B premiums. You know why they can do that is because they're being paid thousands of dollars per enrollee per Medicare Advantage. And you can see the MedPAC study in June of 2021 where no iteration of Medicare Advantage in any form since its inception in 2010 has saved the Medicare program any type of money to where it is going to be beneficial for the taxpayers, for the U.S. taxpayers paying into it, and for future taxpayers. So just to let you know, this give back program and give back premium give back is not from CMS, nor is it from Medicare or the Centers for Medicare and Medicaid Services, or Social Services, I should say. Okay, supplemental benefits. So in 2022, Medicare Advantage plans are expanding supplemental care benefits, dental, hearing aid, eye care, OTC drugs, fitness benefits, non-health related Okay, so when it goes into benefits that are non-medical, so there's medical, and then there's non-medical like fitness, and non-health related benefits, meals, transportation. Those are non-health related, right? So when it goes into that, it's specifically most likely talking about the beneficiaries that need the most help for activities of daily living. So specifically the disabled, as well as the folks that are qualified for Medicare savings programs that are run by the states, as well as folks that are qualified for full Medicaid by your state. So here's some more information about the supplemental benefits. They say supplemental benefits, but really it's talking about dual eligible folks, Medicare and Medicaid eligible within your state, and that way you could be eligible for these other benefits. The TV commercials are getting hit hard by the Office of Inspector General for misrepresenting this type of benefit information for the millions of beneficiaries out there, that when they were plugging the Joe Namath advertisement during open enrollment, during annual enrollment period in 2022 or 2021. Okay, so you can find a list of supplemental benefits at the bottom of your Medicare Advantage plan details. Begin by viewing your Medicare Advantage plan in your area, blah, blah, blah. Okay, so yeah, you can just compare. So that's the top 10 list of your current Medicare plan from 2021 to 2022. It's literally January 5th. I'm dating this, but it's very important for you to understand the ways that the Medicare Advantage private insurance companies are affecting your cost, your hard-earned dollars, and crosswalking you into plans that you have not seen any paperwork or signed any applications on. Now, I say that to make sure that you are a smart consumer, and that way you can look for an advocate that will help you with the information on your side. So if this has helped you in any way, please subscribe. It really helps out the YouTube algorithm on my new channel here, Michael C. Fischbach /Medicare Savings. If you have any questions about your standalone Part D drug plan at the end of the year, you can always give us a call. You can go to medicaresavings.us or call into our hotline 1-888-608-0654. We typically respond to you via text, so that way we know we can ask you questions, and you can and ask questions to us via direct thread with one of our licensed agents or partners that we trust to be able to give you the type of information that you are requesting from us. So take care. God bless. I hope this list of the top 10 ways your current Medicare plan can change in 2022 has helped you or someone that you know. Take care. God bless.